Do not leave this podcast without going to the link in the show notes or description and clicking on the link to learn our centralization process. We will show you what you're missing in your sciatica recovery. And in this link, there will be a very important opportunity at the end for you to learn exactly what this plan could look like for you. Hello and welcome to episode 93 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is the first exercise you should try for sciatica. This episode is worth gold. Okay, this is gold, and you are listening to this or watching this for free. So the intention here is to provide you some initial steps that you might be able to literally see massive improvement in your sciatica without consulting us, without paying a dime. Okay, we're giving this away to help a lot of people. But ideally, if you're someone who is serious about your health and you value my advice, you value this content, and you notice some improvement with what we talk about today, but maybe you're finding some improvement, but it's not lasting, and you're not sure what to do next, then we're hoping that you reach out for help. We're hoping that you say, okay, I've gained so much value from this, and I can see they're helping me get to the next step without even consulting me. It's time to consult with them. It's time to invest in my health. It's time to do something serious. That's what we're hoping we get from this, right? We're hoping thousands of people are going to find immediate improvement and find help. And then we're helping the people who maybe they need a little bit more help. They need a little bit more one-on-one attention. They're going to become clients of ours so that we can help them, right? Just being very transparent about that, okay? We give away a lot of value, and we want the opportunity to help you in return if you need it. There's thousands of people who become pain-free just because of the free content we post. And they message us and say, hey, I was dealing with back pain for years. I was scheduled for surgery. Your free content got me out of pain. That's awesome. We celebrate those victories. Good for them, okay? But some people out there, they need additional help. And that's what we're here for. So, first off, what is sciatica? Let's define it just for a second. Sciatica is defined as pain down the back of the leg following the course of the sciatic nerve. It is a loose general term. It is not really used in medical context. This is not a term we would really use with our colleagues, but it is a very common loose term. And some people will say, hey, Grant, I'm not sure if I have sciatica. I don't really have like burning in my leg or pain, but I have numbness and tingling. Is that sciatica? I would say, technically, it is not sciatica, but it is sciatic nerve symptoms. I just have a tightness going down my leg, no pain. Not sciatica, but sciatic nerve symptoms. Electricity, sciatic nerve symptoms. These things would not be technically defined as sciatica, but they would be sciatic nerve symptoms. I'm saying the same thing, but just in a different way. This is semantics. So sciatica is defined as pain down the leg, but sciatic nerve symptoms can represent many different ways. Sciatic nerve symptoms can be pain, can be electricity, can be numbness or tingling, can be weakness, can be a tight sensation. These can all come from the sciatic nerve or disc herniation related issues. Now, if you find yourself in some acute pain, maybe you just noticed over the years it's crept up more and more and more and more and more, and then all of a sudden you realize you're in a bad position. Or maybe you're a nurse moving a heavy patient and you feel really tight and locked up that evening and especially the next day. Maybe you're deadlifting in the gym and you feel a pop. The next morning, difficult to stand up straight. These are very common scenarios, and you're getting some sciatica or sciatic nerve symptoms down the back of your leg. It is additionally helpful to identify common symptoms. For this number one exercise I'm going to give you for sciatica, most of the individuals who respond best to this are people who notice that the longer they sit, the worse they feel. That bending forward to put socks and shoes on does not feel great and is difficult. And if they have been sitting for a long time, when they go to stand up, it's really stiff. It's like hard to stand up straight sometimes, okay? These are the type of people who are the home runs in our program. These are the people that usually get pain-free within 2 to 3 months. And these are the people I'm talking to today. So if I had to tell you the first exercise to try for sciatica, right? I don't know your exact situation. Let's keep that very, very clear here. I'm talking to a massive audience right now. If I was talking to an individual, this answer might be a little bit different. I would advise that the first thing you do to understand what this exercise is going to do is establish a minor clinical audit. What does that mean? Bend forward a little bit to see how it feels. Bend backwards a little bit to see how it feels. Perform a bodyweight squat to see how it feels. Just get an idea for how your movement currently feels. Pay attention to where that sciatica is in the leg. Okay, let's say for the sake of the conversation, it's going to your knee. Okay, just for the sake of the conversation. The first thing I would try, lay flat on your stomach. Bring your elbows under you or your forearms under you like you're going to do a plank. Push your upper body up off the floor, but keep your hips on the ground. So it looks like you're doing a push-up on your forearms, but keeping your hips on the ground. This is what we call our prone extension position or our prone on elbows position. This is one starting stage of many stages. Many progressions. It's like if you're going to take, a very low dose of a pill and you're going to progress through the higher doses of that pill to get full relief. This is like level 1. Okay. This is level 1 out of level 10. Okay. But we gotta start somewhere, right? And I gotta be safe here with my advice. So I'd recommend you lay flat on your stomach. You prop up on your elbows or your forearms and you push up a little bit and you see how far you can go comfortably with this. Okay. You might feel a little bit of tension at the top. Okay, you might feel some pressure in the low back or a pinching sensation. That's not uncommon. After you've had an idea for how far you can push up, now lower yourself back down and then push yourself back up and then back down. We're going to do this for repetitions. I recommend just starting with 10 reps. Okay, get an idea for how those 10 reps feel, how it changes as you do this. Pay attention to how it changes. Does it get tighter and tighter and tighter as you do it? Well, if it does, then there's a second exercise that we take our clients through. If it gets looser and looser and looser as you do it, that's a great sign. Okay, pay attention to how the leg pain is changing. At the start of the set, maybe you're noticing the leg pain, the sciatica down to the knee, but by the end of it, you're only noticing it in the mid-hamstring or in the glute. This is centralization. This is the process that I talk in depth about if you follow the link in the show notes, which you need to visit. I'll talk you through that and you can get a chance to schedule a call with us to go through this process as well. But that's an extremely good sign. Okay, then stand back up and redo those initial tests, those initial movements to see how they feel now. Your forward bend, your backward bend, and your squat. See how they feel now. We're not expecting them to be 100%, but you're checking to see if your range of motion is better, if your sciatica is less, if the movement feels easier, if you can go further into it, maybe until you feel the same amount of pain. Maybe you bend forward and the first time you felt symptoms down to the knee. And this time, hey, I still feel symptoms down to the knee. But pay attention to where you are. Are you reaching 10, 20, 30 degrees further forward? Okay. That's a really good sign. That's centralization. This tells us that now the following months of steps that are required to fully resolve this have a very, very, very high chance of resolving your situation. That one movement, that one stage is not going to be a full solution. It's not, right? This recommendation, this podcast is the first exercise to try, not the only exercise for complete pain relief. That is not what this is. This is the first exercise to try. If this first exercise that you try feels good, congratulations. You're a perfect fit for our program. And what is your back issue? Your back issue is going to be defined as a flexion intolerant disc obstruction. Most likely, you're going to have a flexion intolerant disc obstruction with nerve tension. Okay, this is the most common client that we see. This is the most common low back issue that we see. This is what our low back program is built on. Okay, now it is customized. Not everyone fits that paradigm, right? Some people who I said they might feel tighter as they do it, they need a different course of action over the first 3 weeks. Some people, they don't get any benefit from this. And we find that they're more of a nerve problem, more of a nerve root problem. Well, then we go into our nerve openers, our nerve closers, our mobilizations, or our tensioners, or other variations of the spine that will mobilize the nerve in the fashion that it needs. That's why we go through an hour-long assessment with all of our clients before we enroll them in the program. Right? Let me know the last time you went to your general practitioner or any medical doctor or orthopedist or whoever, and they spent an hour with you. going through an assessment. Let me know the last time you experienced that. And if now you're starting to think about that, the next time you go to the doctor, set a timer. Set a timer the moment your doctor goes into the room, and then check your timer when they walk out of the room. Okay? The average time, at least in the United States, is, I believe, 3 minutes. I believe that's the average time. We're going to spend an hour with you to go through an assessment, to give you live results on the call so that you know for sure that this will be a solution, right? This is what we're talking about those who feel like they're spinning their tires all the time and not getting any progress, right? We want to give you a place to start. We want to give you free advice. We give you free advice every single week. We post exercises every single week. We're hoping that you can find some momentum. We're hoping that you can do this thing and achieve the ultimate life that you want for yourself. But if you feel like you it was just temporary, Grant. It was just temporary. It came back. I tried this exercise, but it came back. That's because you need a plan to follow, right? You can't go into a pharmacy and just guess which medication you should take and how much. You'd have no idea, right? I would have no idea. Well, you can't pull up YouTube or Instagram, look at 1,000 different exercises, and just say, I'll try this one today, I'll try that one tomorrow, and expect to get anywhere. That's not going to work. You need to know what medication to take, how much, and when to progress to the next level, and how long to take it to ensure that your condition is fully resolved. The same thing goes for movement. We don't blow anybody's mind with doing some fancy exercise they've never seen on the internet before. We blow people's minds with how simple but structured our guidance is. We blow people's minds with the guidance. And those who stick to the plan and who follow the guidance, well, those are ones like our client in Australia who achieved sciatica reduction in 2 days, right? It's possible. You have to believe it's possible. You have to seek the right guidance, and you have to commit to it. And that's what this is all about, is helping people find a resource so that they can get out of pain. Helping people find resources so that they can improve their current situation, or just improve their performance in the gym, or just ensure that they're not going to develop lower back issues. All of those are extremely valuable. And we want to make an impact on the world in regards to lower back issues to get you out of this situation. So if you're ready to take that step, and this podcast was helpful, and you find that this exercise was helpful for you, congratulations. We have the plan for you. Well done. Submit an application on our website, or visit the link in the show notes and go through our centralization process sciatica relief guide, and then you'll get the opportunity to schedule a call with us after that. Take action in your health. Be ready to invest in yourself. Those who are willing to put in the time, who are willing to invest, those are the ones that get out of the situations. And it's time for you to invest in your life, because this is something that could change the rest of your life. You don't want a low back issue that's been around for a few months to turn to a few years, to turn to a few decades. We've seen it happen, and we don't want that to be you. So if you would like help with your sciatica and getting out of pain as quickly as possible so that you can get back to your life as quickly as possible and stop spinning your tires, we are here ready to help and would be honored to do so. If you need more convincing, join our free Facebook group. You will be immediately tagged in our free step-by-step sciatica guide upon enrolling, and you'll see us share a lot of other clients who are winning, and it might encourage you a little bit more to jump in the race. Either way, you'll see tons more information in there, much more resources, more free guides and free tutorials and stuff like that, so you can learn how to better your situation. If you're watching this video on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review so we can help more people and reach more people. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.